Hey, the overhead said there's a medical emergency near the cockpit. Yes, I'm the flight attendant. Are you a doctor? I'm a medical student. This passenger just passed out. He woke up, but he's still very groggy. Hello, sir. We have a first aid kit, so I checked his blood sugar and his is only 42. That's low, right? That's definitely low. This could be a glycogen storage disorder. What? Sir, I think you might have von Gerke's disease.
Von who?
We should check a lactate and a BMP to confirm. I'm not sure we can do that. Then we can do the genetic testing after that. We definitely can't do that up here. Why not? How do we treat him? I'm afraid there is no cure.
Am I gonna die?
Sir, I'm sure this is a lot to hear. Why don't you tell me your understanding of everything going on? I'm using the spikes mnemonic for difficult conversations. This is assessing the patient's perception. Do we need to land the plane?
I'm feeling really nauseous. Can I have some juice?
Wait a minute. Nausea can be a sign of a neurologic abnormality. A hormone imbalance can be causing a problem with glucose production. Should I get him the juice though? Juice? We need an MRI to assess for a possible brain tumor.
I think I'm gonna pass out again.
I really think he needs juice. No, we need to keep him NPO for possible emergency surgery. What? Are you trying to kill him?
Hey guys, I'm getting really sweaty.
It's a pheochromocytoma. Wow, first day of med school. It's finally here. Are you excited for anatomy lab today? Apprehensive might be a better word. Dude, I'm so glad to hear you say that. I've been super worried too. I've heard some people faint in anatomy lab. I'm like, what if I'm not cut out for this? Okay, I'm more worried that they might not have Swan Morgan scalpel blades for me. What? That's the brand I've been using for my practice sessions in my home anatomy lab this summer. I'm sorry, did you say home anatomy lab? Yes, my father had it installed for me. I find that I'm far more efficient with the Swan Morgan than with a Dansby, for example, and I wouldn't want that to affect my evaluations. Oh, was I supposed to be doing that? Well, I suppose it's not required, but I was always taught to take initiative in my areas of interest. Got it. Did you focus on research for the summer, I assume? Well, mostly lifeguarding, honestly. Oh. And reading. Oh yes, I had a voracious appetite for medical texts myself. What were your thoughts on the new Robbins edition released last month? Pretty good. Honestly, I had a similar assessment. Oh, good. Otherwise, I've been struggling to settle on a career path for myself. Oh, hey, no worries. I have no clue what specialty I want to do either. Interventional cardiology offers such exciting life-saving opportunities, but electrophysiology has such promising technologies. Okay, I need to go sit down. Okay, sir, and do you smoke cigarettes? Yeah, like maybe a pack a day. And any recreational drug use? Yeah, sure. Oh, yes? Marijuana or cocaine? Yeah, when I can get it. How often is that? I use Poliwiz too, some ice. Did you say Poliwiz? Yeah, I know it's not good for me, but you know. So what's your method of delivery? What? Like, how do you take it? I just get it from my dealer. And then you inject it? Inject Poliwiz? No. Oh, of course. What's the dose? Dose? Never mind. You said another drug as well? Ice. Ice? Yeah. Ice? Like in your drink? No, I don't drink it, I snort it. You snort ice? That gets you high? Uh-huh. Oh, wait, is ice like a code name? A code name? Like acid for lysergic acid diethylamide? What are you talking about? What are you talking about? Crank, speed, action movies? Angel dust, glass? Wait, are these other drugs you're taking? No, man, it's meth. Street names for meth. Sorry, I'm just a med student, so I don't know everything yet. It's okay, man. Just bear with me, I'm a little naive. It's fine. So when you say meth, is that short for methanol or methylene blue? Hi, this is Ben with the Medical Student Overdiagnosis Hotline. How can I help you? Hey, my name's Matt. My resident told me to call you. Okay. And what year in medical school are you, Matt? First year. Oh, boy. So what's been concerning you? Yeah, well, I've got this weird bruise on my arm, and I'm just sure that I've got acute promyelocytic leukemia. One bruise? Yeah, it's on my arm. I need an oncologist. Whoa, let's slow down. Did you recently have a lecture on the subtypes of leukemia? Yeah, yesterday, but And did you have any recent falls or accidents? Well, I did slip playing basketball on Monday, I guess. It's not leukemia, sir. Just give us a call back if you have any new concerns. Okay, thanks. MSOD Hotline, how can I help you? Hi, this is Molly Carlson. I'm a second-year medical... Yes, Molly, I know. What's been bothering you? My calf muscle twitched a couple times this morning. Okay. I think ALS can start like that. Molly, did you work out yesterday? Yeah. Was it leg day? Well, yes, but I don't think that... I'm not concerned about ALS. Call us back if something changes. Yeah, I've got your number saved in my phone as my emergency contact. I assure you that's not necessary. Hi, this is Ben with MSOD Hotline. How can I help you? Hey there, I'm a third-year medical student. I've been sweating a lot more than usual, and I was just thinking... Okay, it's not a pheochromocytoma, sir. Okay, thanks. Who's going to present Mr. Jones to me? Oh, I will, sir. I'm the fourth-year medical student. Okay, go ahead. All right, so Mr. Jones is a 97-year-old domiciled male with a history of chronic pancreatitis, alcoholic cirrhosis, hepatitis B, hepatitis C, multiple PEA arrests, and COPD on oxygen, 4 liters. He presented about 3 weeks ago after first noticing... Please, skip to the objective portions with vitals, exam, and labs. Okay, this morning he's afebrile with a temperature of 98.7, his heart rate is 63, and his blood pressure is 128/65. I thought you were a fourth-year medical student. I want pertinent positives. Sorry, of course, he's hemodynamically stable, his leukocytosis has resolved, and we're planning to switch to oral antibiotics today. That sounds fine with me. Go run it by the infectious disease attending to make sure he's okay, and then make the switch. Okay, sure. Excuse me, sir, could I run a patient by you? Oh, but of course! He's a guy that your team is actually already following because he has an abscess, and he's actually doing a lot better, so we're hoping to transition. How old is this gentleman? 97. And what chronic problems does he have? He's got chronic pancreatitis and a few other issues. My boy, you're a medical student? Fourth year, sir. I'm afraid you're going to have to improve your presentations if you're ever going to make it as a resident. Of course. Thank you for calling the medical student overdiagnosis hotline. How can I direct your call? Yeah, I need to be connected to an infectious disease specialist right away. Okay, sorry, sir. Hold on. Why do you need an infectious disease specialist? My back has been hurting all day, and I'm positive that it's POTS disease. POTS disease? Yeah, and I need to get started on tuberculosis treatment right away. Sir, have you had any tuberculosis exposures? Not that I know of, but I'm rotating in the hospital right now. And have you had any recent trauma? Trauma? No, I don't. No lifting? No falls? Well, I helped my brother move some boxes yesterday, I guess. Sir, I'm very confident this is related to a muscle strain as opposed to a rare respiratory bacteria infiltrating one of your vertebrae. Okay, thank you. Hi, MSOD Hotline, how can I help? I've got hepatocellular carcinoma and I need help. Whoa, slow down. How do you know you have hepatocellular carcinoma? Well, I've had abdominal pain for about 3 days now, and then suddenly this morning everything clicked. And what were you doing this morning when everything, as you say, clicked? I was, in a lecture. Was the lecture on malignant liver lesions by chance? How did... We have access to your schedule, sir. But that still doesn't mean I don't have it. Now, do you have liver cirrhosis or liver disease? No. You don't have hepatitis B? No. Have you been exposed to aflatoxin? Not that I'm aware of. So what is the likelihood of someone within the United States without those risk factors getting hepatocellular carcinoma? Incredibly low. That's right. Try some Miralax and call us back in the morning. Okay, thank you. Hi, MSOD Hotline, to whom am I speaking? Hi, my name's Mindy. Hi, Mindy. What symptoms are you experiencing? Oh, it's for my boyfriend, not for me. Is he a medical student? No, but I am. Okay, so what do you think? I think he has Creutzfeldt-Jakob disease. You think your boyfriend has a rare prion disease? He's irritable all the time and his whole personality has changed. Creutzfeldt-Jakob disease affects 1 person per million per year. My boyfriend is that 1 in a million, I'm sure of it. Okay, is he having any neurologic symptoms? Well, he was having tremors last week. Really? I called in because I thought he had Parkinson's disease, but you guys told me it was just from intense weightlifting. Okay. He's been super irritable, though. Anytime I try to ask him the orientation questions, he just says, Mindy, stop trying to diagnose me with some rare disease. What? Exactly. It's concerning, right? Mindy, what are you doing? Nothing. Are you calling that hotline again? No. Okay, I've had enough of this. We're through. Kevin, no! Oh my gosh, Mindy, I'm so sorry. I heard that whole thing. Can you connect me with a cardiologist, please? What? Why? I think I have Takotsubo cardiomyopathy.